Did you know that deaths from opioid pain medicines in Australia have doubled in the last decade? And prescription opioids contribute to 2 deaths and 75 hospitalisations every day? The good news is that you can develop an opioid safety plan with your pharmacist to reduce your risk of harm. These harms are not just from taking too much. They can happen to patients who take their medicine as prescribed. Your risk is higher if you are prescribed high-dose opioids, if you mix it with other medicines such as sedatives, or if you have other health conditions. Even if you're careful with your medicines, unexpected factors like changes in health can increase your risk of severe side effects. The most severe side effects from using opioids are loss of consciousness and difficulty breathing, which, in a worst-case scenario, can cause death. This is sometimes called an overdose, but it can happen even if you take your normal prescribed dose. Naloxone is a life-saving medicine that can reverse the effects of opioids in an emergency while waiting for an ambulance. So anyone taking prescription opioids should consider keeping it in the home. Keeping naloxone is like having a fire extinguisher, first aid kit, or EpiPen. We hope you'll never need it, but it is important to have in your home just in case. Naloxone is available at your pharmacy and you can get it without a prescription. Keep naloxone in your home as a part of your opioid safety plan. There are 3 key ingredients to your opioid safety plan: prepare, prevent, and respond. You can discuss these steps with your pharmacist using the MAXIMISING opioid safety leaflet as a guide. To prepare, make sure you keep naloxone in an accessible place at home and discuss the opioid safety plan with your family, friends, or a carer. To prevent, as with all medicines, there are some things you can do to reduce your risk of severe side effects. For example, do not mix opioids with alcohol or other sedative medicines. Always stick to your prescribed dose. Use strategies to remember when you have taken your medicines. Stick to the same doctor and pharmacist for your treatment. And ask your pharmacist or doctor about other ways of managing pain. To know when to respond, make sure that you and others recognise the signs and symptoms to look out for and know what to do in case of an emergency. To respond, first call 000 and then administer naloxone. Naloxone is easy to administer. It's just 1 spray or 1 injection, and you can check the product for more details. Ask your pharmacist about naloxone today. Keeping naloxone in your home could save a life.